11 Alive's annual Canathon. With your help, we can stamp out hunger in Atlanta.
Morning news should be informative and fun.
Yeah, and we do that here on Morning Rush with Verify, Connect the Dots, Why Guy, and more.
We love learning about new things and sharing them with you.
We make the news make sense.
Morning Rush, weekdays 5 to 7 on 11 Alive.
The Negro.
Who is the Chief Medical Officer for the Department of Public Health. Vic, thank you for being with us today and appreciate both of y'all's work on the vaccine distribution and also continuing to fight COVID-19. General John King, our insurance commissioner who is leading the vaccine distribution task force, is not able to be here today, but I certainly want to thank him for all his efforts in recent months as we've taken the fight to COVID-19 and made plans to deploy a safe and effective vaccine. Today I'm going to be brief so that Dr. Toomey can walk through some of our planning that our teams have been working on the last few months related to vaccine distribution. Our top priority has been to deliver whichever vaccines were approved to the people of our state in a safe, efficient, and coordinated fashion. Last week I held calls with our leaders of the nursing home industry and our hospitals to walk through their coordinated efforts to combat COVID-19 and ensure that these critical institutions had the supplies, manpower, and resources necessary to continue this fight throughout the winter months. I was also able to speak with representatives from CVS who are working hand in hand with Operation Warp Speed to serve as a linchpin of the federal disbursement strategy nationwide. I want to take a moment and just say how grateful we are to Operation Warp Speed and the Trump administration for this unprecedented and incredible achievement. The public-private sector partnership working together has developed a miracle of modern science that will save countless lives in the days ahead. Dr. Toomey is going to provide an overview of our strategic plan here in just a few moments. But I wanted to stress a few takeaways real quick from today's briefing. Number one, yes, we will have a limited number of vaccines that will be distributed within Georgia in the next week to 10 days. However, and this is critically important, our first shipments will not be anywhere close enough for anyone in our state to stop following the same public health guidance that we've had in place for many months. The limited amount of vaccine doses we will receive in the coming days will be going to the most vulnerable and those on the front lines of fighting COVID-19. That means residents of nursing homes and our healthcare workers. The general public will not be able to be vaccinated for months. We must all continue to still wear our mask. We must still wash our hands. We must continue more than ever to watch our distance. Our executive orders have remained virtually the same for months now. We have been able to successfully balance both lives and livelihoods. Georgia businesses have been allowed to resume operations, and people have been allowed to exercise their constitutional freedoms. Not every state has taken this approach, and my plea to Georgians is this: to keep Georgia open, to keep hardworking people employed, to keep food on the table for thousands. Please follow the guidance that we've been preaching for months now. These simple steps have been proven to work. No government mandate is going to get rid of this virus. Individual Georgians stepping up to the plate who will slow the spread of 19. That is what I'm asking everyone to do. I fully realize and appreciate how tired everyone is. Everyone wants to go back to a normal Georgia. I understand that. Our public health workers have worked long hours. Our nurses and doctors have been taking long extra shifts. Our teachers have had to adapt to drastic changes in their profession as well as the rest of our educational leaders. And too many parents have had to figure out a way to keep their kids' education on track, all the while still figuring out how to pay their rent. Waiters and waitresses, hospitality workers, and countless other hard-working Georgians have had to take fewer hours or find a new career altogether. This year has brought unimaginable hardship, but it is my belief that we have lost too many loved ones, too many friends and neighbors to give in to this virus. Too many businesses have gone under, and too many families have literally lost it all. We cannot give up now. We all must do our part so that the sacrifices that everyone has made will not be done in vain. This long nationwide nightmare will end. The vaccine is on its way. Therapeutics, as we know, are getting more plentiful by the day. And I'm asking everyone to continue to hunker down and do a few simple things for the next few months. Wear your mask, wash your hands, practice social distancing, and continue to follow the public health guidance that we've had in place for a very long time. Remember that we are all in this together, and we will get through this together. And I'm confident that our best days are still ahead of us. So thank you, and God bless you, and I'll now turn it over to Dr. Toomey.
I'm attached to my mask. Sorry. No, thank you, everyone, for being here, and thank you, Governor, for your leadership. I'm very happy to be here today to give some good news about COVID to everyone. We have been working on our strategic plan for the vaccination program for more than several months. We started early on using our pandemic flu plan and built on that with the public health system as the foundation of that plan. And we did that because the infrastructure is in place to be able to deliver the vaccines efficiently and effectively, and then building on not only our 159 county health departments, but also our partnerships with hospitals, with private sector providers, and many other providers throughout the state. I think it's really important to recognize that the whole process is changing literally daily as we're getting more and more information from the federal government. The amount of vaccine we will get will likely be, at least initially, over several 100,000 doses, although that may change, and we will be getting that in several tranches weekly, but we may have additional available. So I'm not giving you an exact number because I expect that those numbers may change over time, and we actually may have additional vaccine available depending on kind of the overall national supply. The other thing I thought was important to emphasize is the fact that with the limited vaccines initially available, we felt it was very important for us to follow the ACIP guidelines. That's the advisory group to CDC on immunization practices. ACIP is an independent organization. It's not a government entity, and it looks at not only the science but all the ethics of who needs to be vaccinated first. And we have chosen to follow ACIP here in Georgia rather than kind of go on a separate course. And I think that will allow us to provide vaccine initially to the most vulnerable, as well as those who are most at risk because of the work that they do. And so following ACIP guidelines, this initial tranche of vaccine that becomes available in the next several weeks will go immediately to healthcare providers working through largely through the hospital system as well as our public health system, and long-term care facilities, both their staff as well as the residents, recognizing how many individuals have been affected in those facilities. In the next round after that, we hope to not only address the needs of essential workers, including, for example, nuclear power plants, the power facilities, those individuals that keep our our state running, as well as older individuals over 65 with multiple health conditions who may be at higher risk for complications. But we have to wait for the ultimate guidelines to come out from CDC, and they'll be coming out in the weeks ahead. We expect to have both a combination of the Pfizer and the Moderna vaccine. Again, there are two different vaccines that we hope will become approved by the FDA through an EUA, through an emergency use authorization in the next several weeks. The Pfizer vaccine requires minus 90 freezers. We have those freezers available all over the state. I have identified them, as well as have purchased them within public health, and have worked out a mechanism to transport vaccine even without the freezers through special carriers that Pfizer has provided in partnership with the vaccine program. The Moderna doesn't require that those deep freezers, it's a regular freezer, and so that'll be easier to transport. We'll be working in partnership with the Georgia State Patrol to transport that vaccine to the various facilities, whereas the Pfizer vaccine will be transported directly to hospitals, for example, that may be distributed, be providing those vaccines to their healthcare workers, and we'll be able to provide more details on that if you're interested. I think one of the things that is particularly important to emphasize is that communications about these vaccines are particularly important. Communications, because there's 2 doses for both of the vaccines, whether it's the Moderna or the Pfizer vaccine, both require 2 separate doses, either 3 weeks or 4 weeks apart. That means not only do we have to have the system in place, which we do, to track and monitor and call individuals back, but to make sure that people will be willing to come back for that second dose. We want to be absolutely transparent about the fact that often that second dose, or even with the first dose, there may be some side effects of the vaccine that are short-lived and not a difficult thing to deal with, but it may discourage people from going back to the second dose, including mild fever, pain in the arm where the vaccine was administered, or even some flu-like feelings. Again, being very transparent, I think that's something that we need to communicate about. That's to be expected. It's not a complication. It's not a problem that needs to be worried about, and that we need to take that into consideration as we're vaccinating healthcare providers and others, that they may miss a day of work after those vaccines. The other thing that I think is extremely important, and I have mentioned this before, even as we did our planning for this for months and used our influenza vaccine campaign as a model of how we would roll this out, is that many, many people are hesitant about vaccines in the state anyway. And I heard someone say on the radio the other day that this is the only vaccine that's had its own anti-vax campaign begin even before a vaccine was produced. And I think that's a challenge that we have, because we have to reassure everyone that this vaccine is safe, effective, and there's good science behind that. And many, many people in my own community, my neighbors, my friends, my relatives, both here and out of state, have said to me, are you getting the vaccine? And I can say with great enthusiasm, I can't wait to be vaccinated. I'm so looking forward to that opportunity, and I hope that we can convey that same desire to people throughout Georgia, because until we can vaccinate as many Georgians as possible, we will not have the level of immunity within the state as a whole to prevent continued spread. And I think that is an important thing to say. I think the messages will be particularly important in African American communities where there has been a disproportionate impact of COVID on those communities and disproportionate complications. We really want to ensure that our communication messages focus on the concerns and the good science that's there, that we feel very confident that these vaccines will work, are safe, and are important to ensure the safety of all Georgians at this time. The final thing is to say that I hope that we can continue to communicate about this as we roll out our vaccine plans. There's many things will likely change. We will have to be agile because on the federal side, a lot of the issues, and particularly the vaccine, numbers of vaccines are changing and increasing. The exact quantity of vaccine, the exact type of vaccine we're going to get has not yet been clarified. We will clarify that as soon as we have that information available, and we'll share that with you on an ongoing basis. I expect to be communicating with you regularly throughout this process so that we not only have the most accurate, up-to-date, transparent information available, but that also we can ensure that people feel comfortable with this vaccine program, and that we can encourage as many people as possible to be vaccinated when the time comes and the vaccine is available to everyone. We expect that this vaccine will continue through this year. Probably not till summer will we have vaccine for everyone throughout the state. But throughout that time, the other message that I need to convey, as the governor laid out, is we can't give up, we can't get tired, we can't give up the continued attention to all those simple safeguards that will keep us safe during this time, even as we're working to ensure the vaccine is distributed throughout the state. And wash your hands, wear a mask, social distance, follow the guidelines for gatherings. Looking forward to Christmas ahead. Again, that could be another opportunity for us to try to prevent new cases as we protect our families, as we did at Thanksgiving time. And the last message I can't forget is get a flu shot. It's not too late, even as you're waiting for your COVID vaccine, to get your flu shot. It's not too late in the season. We are so far seeing a very mild flu season. I think part of that reflects the fact that everyone is following the guidelines more effectively than we had in years past. But it's important, again, to protect our hospitals and to continue to protect our communities, to ensure that we have the least number of flu cases this year as possible. As we approach nearly 500,000 COVID cases in Georgia, at the numbers I looked at today, I think it's really important, again, to emphasize how these basic measures will need to be continued to be followed, even as we roll out this vaccine campaign with unprecedented speed and good science behind it. And before I turn it over to the governor for questions, I just want to say, I want to again thank not only our medical partners, the hospitals, the providers who have been working with us diligently, as well as the long-term care facilities, and the pharmacies, CVS and Walgreens in particular, who will be partnering with us on long-term care facilities. I also want to say many thanks to our public health, our county and district public health officials who have been working with us from day one, who will continue to provide testing during this time, but also will be really the foundation of our vaccination program. That's a lot of basic information, and I look forward to answering questions. But before I do, I want to introduce someone to you. If he'll stand up, Dr. Vic Kapil is our Chief Medical Officer. You haven't met him yet. He has joined us, like myself, had 20 years plus at CDC, a long history of leadership at CDC. We're so grateful that he has joined our team and is over the medical programs, including our vaccination program, and can help guide this along with me. So thank you, and thanks for being here. Do you want to come? Yeah. I'll just leave my numbers.
Well, thank you, Dr. Toomey, for that update. Thank you for your continued leadership. I would just echo as well as I did earlier. We're glad to have Vic on the team, and we are all continuing to work hard together on the vaccine distribution, but also continuing to fight COVID every day. And with that, we'll open it up for questions.
Great. This is Sam Whitehead from
Go ahead, Sam.
Yeah, Sam Whitehead from WABE. Thank you, Governor, as always, for taking questions. You know, we've seen over the last number of months our number of cases slowly start to rise here in the state, and you and your office have declined to put any additional strong public health measures in place. I'm just wondering, reflect on that if you could for me. I mean, you say the state is doing all right, you say we want to protect livelihoods as well as lives, but how do you think your approach has been working so far if now we're at a place where we were this summer, where cases are high? I was on this call with the hospitals. They're concerned about bed capacity, staffing. Just reflect on the situation for me if you could.
Yeah, so let me just give you a little update. And obviously, we've been following the numbers daily. I mean, our cases are going up. All of our metrics are going up, and certainly our hospitalizations, which is the one number that I continue to watch as much as anything. We've had great conversations, as I mentioned earlier, with our long-term care facilities and our hospitals. You know, we know and have been talking to them about staffing. We're also working with our partners in Washington about the CARES Act funding ending 12/31, which creates some issues with potential additional staffing resources. So we're working and planning through that as we speak. You know, I think there's good news here, and then there's not so good news, right? If you look, and I did last night, and we talked about this morning, the cases per 100,000 comparing all the states and territories, I mean, we're like 44th, or we're way down the list. So we're faring much better than the rest of the country, which I think is a good thing. The bad thing is we know that we've got something going on right here, you know, and it started actually, I believe I'm correct in saying this, a little bit before Thanksgiving, which is why, you know, Dr. Toomey and a lot of other people, and including myself, really urged people to be careful over Thanksgiving. And I believe that most did. But I also think, as on all these holidays, you had some people that let their guard down. We're obviously seeing more community spread now. I would urge my fellow Georgians, if there's an activity that you don't have to do that involves being around a lot of people, don't do that. Continue to follow the guidance that I know I mentioned at least 3 times in my short remarks about masking, distancing, follow the health guidelines. We're continuing to stay in touch with our hospitals. I will say this, with the increases we've seen with our hospitals, we don't have near the panic, if you will, that we had early in the pandemic, because we have better treatments, we got better therapeutics. We're better managing that just because of what we have learned with the virus. So I feel good about that. I'm definitely concerned about those numbers. We're watching them closely to see what else we can be doing like we've done in the past. We have our surge capacity bed plan. We're continuing to work on the movement of patients if that's needed through the coordinating center at Grady. I want to thank them, as well as the General Assembly and our state leaders for supporting the funding for that. That is something that has served our state very well. So I feel like we're in a good spot, but it's like I said in my remarks, it's going to be our citizens that flatten the curve by using best practices, doing things they don't necessarily have to do. And when you look at our outbreaks on the report that I read this morning from the health team that we have, we're seeing those in some manufacturing type businesses. We're seeing those in some of our schools, and then in other places like churches and other things. So, you know, we're not seeing, and we had less, I hate to say super spreader, but we had less of those big type events that we documented this week than we did last week. So I took that as an encouraging sign, but there's still enough signs out there that give me grave concern. And that's why I want to ask everybody to continue to do their best to help us be part of the solution, not part of the problem. And our businesses that are open and able to pay people and provide to our economy, which has been so strong, we need them to make sure that they are continuing to follow the guidance and the guidelines that we have in place. Those things have been working. They worked in the past. They'll work now. We've just got to all make sure that we double down on that, even if it's just for a couple of weeks to get us over this hump, and then we can regroup as we go into Christmas and Hanukkah and other holidays.
This is Andy Miller, Georgia Health News. I had a couple of questions for Dr. Toomey, if that's okay. About the vaccine, I'm right here.
Sorry, hey.
That's all right. The several 100,000 doses you talked about, is that going to be enough to cover those healthcare workers?
No. Nor will it be enough to cover the long-term care facilities. We know that.
So how are you going to distribute them with that challenge that you just talked about?
I mean, we are working with the hospitals themselves. They are ordering vaccine. We have been talking with them and will continue to have communications with them about how to prioritize their own workers within that priority population. That some individuals within hospitals are more at risk than others. For example, a respiratory therapist, someone in the COVID unit, the ICU, will be more at risk than others who may not be exposed to COVID constantly. But we will continue to work with them and continue to roll out the vaccine as it comes in, so that we hope by the certainly early January, I would think, that we would have all healthcare workers covered. And we'll be agile with it. We don't know whether we'll be getting Pfizer, Moderna, in what proportion, but we will just go with it, what we get, and very quickly get it out to the providers, and they're ready to accept it and ready to go. I mean, this is something that we have planned and have actually exercised. We've done several emergency exercises, even in the last several weeks. We are doing another tabletop tomorrow. You know, people are primed and ready. The providers are ready to go. So I don't think that there's not going to be a problem of vaccine wastage. I think there's going to be, we're going to get that out. The one thing that you can help us with is to ensure that we get demand. I get feedback even from providers that there's still concern about the vaccine safety. And I can't emphasize enough how confident I am in looking at the data, and even the new data that was available today, that this vaccine is safe. No question it's effective, and that it will be a game changer for us in Georgia once we're able to immunize not just the healthcare providers and long-term care facilities, but everyone in the state.
So will providers make the call in terms of who gets vaccinated within their facilities?
I mean, the individual, they make the distribution requests. It's in the end, it's our state public health immunization team that makes the final call about where the vaccine goes. But within the hospital itself, they make the call, but we make some recommendations about who gets it within those facilities.
Will rural areas be more of a challenge getting the vaccine to them and distributed versus, let's say, Metro Atlanta?
No, I think because of how we've worked this out, both through pre-positioning of vaccine, the freezers, as well as our partnership with the National Guard, we'll be able to get this throughout the state. I'm very confident of that. And the fact that all of our health departments, every single one, 159 health departments, are part of this activity, they will be, in a sense, really critical to ensuring that we get the vaccine to everyone, no matter how remote the area. And I think I've answered the question. I just think that I'm very confident about that. Unless, Vic, you want to answer anything else?
Good morning, Riley Bunch with CNHI News. This is probably for Dr. Toomey, but Governor Kemp as well, I'm sure you can chime in on this. Piggybacking on Andy's question, what is the state's strategy to make sure that marginalized and rural communities have equal distribution of that vaccine throughout the distribution process? So not just this first round, but until everyone's vaccinated.
No, we are looking at population, but we're also looking at requests, and our public health directors are really in charge of how this is being done, so they are looking out for their rural areas. So it isn't as if we have a metro focus, we have a statewide focus with great advocates for rural areas, and we'll ensure that we have adequate coverage for everyone. I think it's something I feel strongly about. We're having our surge right now is not a metro surge, it's a statewide surge, so everyone throughout the state needs this, including those providers in rural areas. So we will be ensuring through the mechanisms of vaccine delivery and the coordination with public health, ensuring statewide coverage.
There, Nicole Carr with WSB. We talked about the state's standing as compared to others in the country, and we've also talked about when we add our antigen cases in, what our outlook looks like. In wanting to preserve economic stability, is there a point, do we have a metric where we go into stricter guidelines? And if not, with citizen responsibility, do we ever go back to daily briefings and to talking to the public every day and hammering in what we need to do?
Yeah, sure.
Well, I would just tell you that we watch the numbers daily. You know, we're not setting some number over here 2 weeks from now and then try to figure out what that looks like 2 weeks from now. I think we've seen in the past people that have done that. It boxes them in. It does not allow them to be flexible. The best thing that we have going for us are these two people right here. There's nobody in the country, I think, that has as much experience as they do in public health, dealing with these type issues, and they're doing a great job. So we're going to continue to make decisions on data and science and where we are with our systems, which is why I stay in constant contact with our hospital CEOs, just not in Atlanta, but all over the state. We're going to continue to do that. You know, same for our nursing homes and other facilities that are out there. To just add one thing to the previous question too on the distribution and where it's going to go in the rural areas. I know I've spoken directly with General King at least twice about that. You will see in the coming weeks and months that he will be, as well as Dr. Toomey, Vic, and myself, continuing to talk about this, so we're transparent with the public. The public is engaged and informed, but I know General King has made it very clear that we got to get the vaccine out to all parts of our state. We don't want anyone to be left out in this endeavor, and he will be on the road, I can assure you, a lot, messaging that, not just to, you know, Atlanta and other metro TV stations, but to local newspapers in small towns that many of us never see every day, to make sure our citizens are informed and know that these protocols and procedures and distribution that we're putting in place applies to everyone in our state.
Do we return to daily briefings again as we start to see the cases rise?
Well, we'll take that one day at a time. I will tell you that, you know, when we were doing daily briefings in the past, we finished the daily briefings. I've had detailed remarks about all that we've done, and the questions were all had nothing to do with the daily briefing. So it's important for us to stay on message and for people to be able to listen to the information that's coming, especially from Dr. Kapil, Dr. Toomey, General King, the rest of the folks on the Vaccine Distribution Task Force, as well as others as regard to wherever we might be with COVID right now. We'll just take that as we continue to deal with it. The best way to avoid having to do all of these things is for people to double down, to help us out just over the next couple of weeks to stop the spread, and let's change the trajectory a little bit. Even if you don't do it for yourself and your family, do it for those hospital workers and the people that are really getting nervous about our hospital bed capacity right now.
Hi, my name is Melina Weiskup with NTD News, The Epoch Times. I just have a couple of questions. Many people have come to me with the concerns about your decision of not calling a special session as it relates to the election, especially with the Senate race coming up. So what was your reasoning behind that? Was this evidence presented at the hearings last week not substantial enough, or was there another reason?
Well, I've been very clear about the special session. I don't know exactly what issue you're referring to fixing at the special session, so that might change the way I answer the question if you have a specific issue that would actually be approached in a special session.
I think mainly just looking more into the allegations of election fraud and possibly overturning the state's results. Do you think that, was the evidence that was presented at the Senate Oversight Committee in the witnesses' testimonies, do you feel those were substantial enough to call a session in order to look into those allegations more, or do you think it wasn't substantial?
Well, let me take the first part of the question, or at least one part of the question, on overturning the electors. That would be unlawful and unconstitutional. I made that very clear over the last couple of days. The Attorney General actually weighed in on that. The General Assembly in 1960 made it very clear that the General Assembly cannot change or overturn the electors in this state if they are elected by the popular vote on the proper day for a presidential election. So that proper day happened. That vote has been certified twice now, and so that the talk of doing that is simply unlawful and unconstitutional. On the part about the evidence that was become in front of a Senate panel, the Constitution and laws of the state are very clear as well. The Secretary of State has the investigative authority for elections, fraud, and everything else in our state. Thankfully, he asked the other day, and I eagerly told him that we would send the GBI to help his investigators to speed up the process, to look for any sort of fraud that is in the election, and that's exactly what they're doing. But he said he has 250 cases that he's investigating right now, or complaints. I feel confident that he's doing that, and he should. But for us to call a special session because of evidence that was presented in a Senate hearing does not address the way that evidence should be used to alter an election in Georgia. That process, by law, is set up to go to the courts. If that evidence is so overwhelming, there's options for the legal team of any campaign that was on the ballot on November the 3rd to take those into a court of law, to present those to a judge and have the judge rule on those matters. This is not an issue that's set up in the General Assembly for lawmakers or myself per the Constitution and laws in the state to deal with. Now that doesn't mean when we get back in session in January that we won't be looking at some of these issues, and I made it very clear that I'm very open to working with the legislature to do just that, especially with our absentee ballot process and perhaps requiring a photo ID in regards to that.
Thank you so much, Governor Kemp. And one follow-up on that, I just wanted to give you an opportunity to respond to some of these allegations, specifically by Attorney Lynn Wood. One of the things he keeps saying is that you have a closer relationship with the Chinese Communist Party, or the Chinese the Chinese consulate. He posted
I know it's a lot to comprehend and get out because it's so outrageous, so I'll just stop you right there. Let everyone remember that Lynn Wood was also telling people not to go vote for Senator David Perdue and Kelly Loeffler. I will assure you, myself and my family will not only be voting for them, we're going to vote for them early and take our name off the list. I would encourage all other Republicans and people that want to save this great country to do the same. It's outrageous that someone like that would even say that in the same breath that he's trying to help the cause of being the red wall to socialism.
Governor Brian Kemp, Joe Henke with 11 Alive. Thank you for the time today. Hesitancy to the vaccine was discussed here a little bit. I was on the roundtable discussion last week with hospital leaders, and Dr. Toomey mentioned, and hospital leaders backed her up, that on the ground, we're hearing from doctors and nurses that are hesitant to take the vaccine. In some hospitals, large numbers of them. What specifically is being done to overcome that burden? And if you aren't able to overcome that burden, a lot of doctors and nurses on the front lines not taking the vaccine, are you worried that that sends a strong message to the public that the vaccine is not safe?
Yeah, and we've actually, that's a great question. We've actually been talking about that. We'll continue to be messaging about that when we get the vaccine. I specifically discussed that on our hospital, Metro Hospital CEO call the other day. You know, they're hearing and seeing those same things, which is concerning. But I also think there's a lot of ways that we can message once the vaccine gets here, with people like Dr. Toomey taking it, myself, other prominent people. I think will give people more confidence that the vaccine is safe, and that's something that we're actually going to be working with, and we'll have more coming to you all in a format like this to continue to reassure our citizens that it is safe and they should take it. And I think once it gets out there and people start taking it, you know, Dr. Ben Watson, who happens to be a state senator, was in the trials and took it, and you know, he'll be a great messenger for us, but there'll be many more like that, including myself.
And just a couple quick other COVID items. One, with where the numbers are right now, we could still see more of an uptick coming from Thanksgiving, since that's not completely in the rearview mirror. Are stronger executive orders for Christmas and New Year's time possibly on the table?
Well, I mean, look, we'll keep everything on the table, but that's what I'm urging people not to have to even consider. You know, we've dealt with this before after holidays. Georgians did, you know, really great work going into some of our holidays in the past. We'll see where Thanksgiving gets us. I mean, I know we still got another week or two to really kind of see where we are and, you know, what the trends are going to do. But it's up to all of us. You know, this is a virus. It is up to all of us. I mean, you look all over the country. Everybody's got all these different regulations, and they're shutting down here and shutting down there, and they're in much worse shape than we are. And I'm not criticizing anybody else. I'm just saying the things that we have in place will work. We've seen them work in the past. Our regulations that we have in place right now are the same that they were when we were at some of our lowest numbers ever. So, you know, we got to get people to help be part of the solution, not part of the problem. And I think half of it is people are fatigued. I mean, they're tired of this. I know I am. I mean, it's been tough on our kids. It's tough on our healthcare workers. It's tough on, you know, people that are out of work. I mean, it's been a brutal time in our state and country, unprecedented in many ways. But this is also a good time in Thanksgiving to be thankful for what we have in these really tough times, and going into really the hope that the Christmas season provides for us to take advantage of that for the next 2 or 3 weeks, and let's get back in a better place. I'm confident that we can do that. But, you know, I'm going to continue to work with Dr. Toomey and the rest of our team as we move forward and literally watch this data every day. We've been doing that every day, even when we were at low levels. And we'll continue to do that.
And last thing, the Arizona legislature has shut down for a matter of weeks because of exposure to Rudy Giuliani with his positive test. He was here at the state capitol, obviously. I believe this past weekend, some state senators met in Athens for the biennial. There's been some criticism of that once Giuliani's positive test came to light. Do you think the state senate has done enough to limit exposure, or would you urge them to stop all in-person meetings for the time being?
Well, let me, I think I may let Dr. Toomey answer that question. I don't want to get into any, you know, HIPAA violations or health or anything else on this. I know that I think our team and Dr. Toomey has worked with members of the General Assembly, the Lieutenant Governor, Speaker Ralston, over the past months, advising them on, you know, what they need to do, and I don't know if she has anything she'd like to add.
No, thank you. I personally reached out to Senate leadership with recommendations. also about, with the new information about the shortened quarantine, which I thought was important because it didn't mean 14 days, it could be 7 days plus a test. And personally talk to a number of the senators and share the information. And I recently, actually the last hour, was on a Zoom call with the biennial, and it looked like a lot of the individuals were actually doing it online, which is as a webinar, not in-person. The in-person attendance was quite small, but whether the individual senators I talked to chose or not chose, I can't say, but I personally share that information with them myself on Sunday and Monday.
Eric Sturgis, AJC. I was wondering at this point, how much money has the state received from the federal government for vaccine distribution, and how much has the state calculated that it will need to help with its plan?
What was the second part of that, Eric? Sorry.
How much has the state calculated that it will need to adequately,
Yeah, I may need to follow up on the budget numbers. I mean, obviously we've spent a lot of money of CARES Act funding, which we greatly appreciate. So we'll circle back with you on the exact numbers on that. I would say this, kind of going, I guess just reading, some of the press that's out there on the bipartisan negotiations that are going on about another addition to the CARES Act, what that looks like going into the new year. We've certainly been in touch with our policymakers in regards to that. Obviously, to me, hospital staffing is a big issue. States having the resources to get the distribution out, to continue to do the proper amount of testing, supporting our public health agencies and community health agencies and behavioral health agencies is a top priority of mine as well. And then you still have the economic piece that I'm sure they'll be addressing too, along with unemployment and other type issues. So we're engaged on that conversation. I have no idea where that's going to go, but if nothing happens, I continue to urge them to give us flexibility with the CARES Act funding that we have now, that we could carry that over into the new year and not have a hard stop on 12/31. All right.
Hey, Ross Williams with the Georgia Recorder. This one's for Dr. Toomey. We've seen a lot of cases in jails and prisons in the state, and I wonder, what can the state do to ensure that inmates are vaccinated, and do you think that inmates ought to receive higher priority for vaccination?
We're going to follow the ACIP guidelines, and that's for all of vaccinations. So I don't believe that they have come out yet on correctional facilities, and we have been very engaged in promoting testing and follow-up within correctional facilities. So until the ACIP meets and finishes its recommendations, we won't comment on that.
Good morning, Yasmina Alston with CBS 46. What will that process look like of getting the vaccine to the general public, especially when there are some who have concerns and hearing those side effects?
Yeah, and I'll certainly let Dr. Toomey or Dr. Kapil answer that question as well. From a kind of a big picture, that's what our immediate focus, as you can tell from today, is making sure that we get the vaccine to the vaccinators, if you will, our healthcare professionals that are literally, in many ways, the most at risk, or at least one of the most at risk, and have been dealing with this the whole pandemic. And that's our healthcare workers, not only in hospitals, but also in our nursing homes and other places. And then getting it to the folks that have been affected the most, our long-term care residents. I think after that, that's what we're continuing to work on and look at, and how we do that, how the logistics will work on that. And we've, really talked a lot about that, and we have a lot more to talk about that, and we'll continue to be transparent with our fellow citizens. But it's going to be a big undertaking. You get a certain number of doses, we have to keep them in these special containers and certain temperatures to distribute them, and then once we get them, we're going to only have so many of those doses in that one container, so trying to make sure when we take it somewhere, we don't have more people than doses, and we don't have less people than doses, so we're making sure that we're being efficient. So those are all the logistical things that the team and General King, Dr. Toomey, and Vic, and the others are working on. Did you have anything you want to add to that, Dr. Toomey or Vic?
With the health departments, as I keep this is a metaphor. I never want to be out without my mask, and so it's just attached to me. But this is why I think it's so important that public health is sort of the centerpiece of our program, because it reaches everyone and it's all over the state. And I think part of that work is part of being able to do this is not only reaching hard to reach populations and those communities that may have be underserved, but also getting the message out from a trusted source. And I think our local health departments are very trusted in their communities because of the work that they do. We also are in the process of developing a very comprehensive communications campaign that will be focused on specific areas and particularly high risk, hard to reach populations, which is also going to be very important. So it's a combination of working in partnership with all of the providers statewide, with the health departments being a core part of that, but also very important communication messages focused on communities, particularly those at high risk.
Thank you.
This will be last one. Hello, this is Valencia Jones with Atlanta's CW69. I just wanted to, we've already discussed how the vaccine will be rolled out and who will get it, side effects, but I wanted to see if you can recap, as the vaccine is rolled out to the general public, who will pay for it? Is this covered by insurance? Will there be out-of-pocket costs for the general public once it finally gets to that point?
You can answer. Yeah, I'll let Dr. Kapil answer that.
Thank you, Governor. The vaccine will be free of charge to recipients. There are no charges associated with the vaccine for anyone who's eligible.
Who is eligible? Other than, of course, you've got your the folks, the frontline workers, the high-risk individuals.
Yeah. Eventually, right now the only population of people for whom there may not be coverage under the EUA are children, but eventually all adults and all of the various groups that we've been talking about would be eligible. The information related to children will likely be coming a little bit later down the line because those trials are, and that data is still being assessed and collected.
Thank you.
Sure.
Yeah, let me just add too that we still have a lot of guidance and communication with the federal government, the task force, Operation Warp Speed, that will dictate a lot of this, and what kind of calls we're going to have to make down the road. Which is why I appreciate you all being here today to help keep our citizens informed, and we'll continue to do this over the weeks ahead. Do we have one more?
Yes. Good afternoon, Dr. Kemp. Governor Kemp.
Please.
Claire Sims of Fox 5 Atlanta. You mentioned that you and Dr. Toomey will be getting vaccinated sort of in an effort to encourage others. Do you know the timeline for that, if you'd be in the first round or a second round?
Well, I mean, I haven't really talked to Dr. Toomey about that. I'm willing to do whatever she thinks would be best. I certainly don't want to take the vaccine from one of our frontline healthcare workers or one of our most vulnerable. However, if it helps give confidence to our most vulnerable and frontline healthcare workers for me to take the vaccine early, I would definitely be willing to do that. So I'll continue to follow the good public health advice that I'm getting for Dr. Toomey so that we can best make people feel comfortable. And I've talked to a lot of people about that, especially in the African American community, that are like, hey, when all the politicians start taking it, come back to me and I'll take it. And so I understand that, and I'm willing to do that at the appropriate time. If that is in the first round, I'll do it. If it's later, I'll do that too. That's how confident that I am. So thank you all.
All right, good afternoon, everyone. I'm Jeff Hullinger, and recapping what we have heard over the last 55 minutes or so from the state capitol, and Governor Kemp and Dr. Toomey as well. Georgia expecting to get Pfizer and Moderna vaccines. It's unclear how many vaccines Georgia will get initially. The expectation, according to Governor Kemp, is in the next 7 to 10 days. Healthcare workers will be prioritized. They will get the vaccine first, along with nursing home residents as well. The governor says it will likely be months before the vaccine becomes available to the general public. And the governor's task force also planning to take the vaccine to increase public confidence, as you just heard. Governor and Dr. Toomey urging Georgians to continue following simple safeguards. You know, we've heard it for months and months, and that is washing your hands, wearing a mask, and social distancing as well. And the full news conference will be on the 11 Alive YouTube page. In fact, it is on there right now. We also heard some other questions that were not related to the vaccine. And Governor Kemp was asked about the issue of the election and if he should be calling a General Assembly to challenge the results of the November election. And he said that simply is unlawful. It's unconstitutional. He said the General Assembly cannot overturn electors. He was also asked about Lynn Wood, who had made some claims on the governor that he was in the pocket of China, and the governor paused and said that's simply outrageous. He said that Lynn Wood is also an attorney who happens to be encouraging people to sit this election out in January 5th. And he said that too is outrageous, and that he and his family will be first in line to cast their votes for the Republican candidates for the U.S. Senate in Senator Perdue and Senator Loeffler. So again, there were some concerns the governor also talked about today as it relates to COVID. He said, yes, the metrics are going up, and Georgia is, though, faring better than many of the other states across the United States. But he says the real problem certainly has been these holidays, that people sometimes become weary of social distancing, of wearing a mask, and Thanksgiving certainly is a holiday that he pointed at over the last couple of weeks or so. And there is that concern as we roll into the holiday season, certainly of Hanukkah and Christmas, Kwanzaa and New Year's Eve and New Year's Day as well. So that is one of the concerns from the governor. But again, a reminder that we will have all of this coming your way tonight on 11 Alive News at 5, at 6, and also on the Big 36 on WATL, where we will have Atlanta News Prime Time will be front and center for most of the evening. A reminder that Days of Our Lives will re-air in full at 3 a.m. That is it for us for now. I'm Jeff Hullinger, and we now return you to regular scheduled programming right here on 11 Alive. Good afternoon.
In fact, 1 in 4 kids in Metro Atlanta live in a home that lacks access to